That country were at their lowest levels since mid-May. It's something that health officials are hoping to repeat across Latin America, as so many other outbreaks are not showing signs of slowing down.
CNN's Matt Rivers. South Africa now has the 5th highest number of coronavirus cases in the world. It's recording more than 12,000 new infections a day at the moment. But the country's strict response to the pandemic is causing severe economic consequences, not least for the food and restaurant industry. Many in the sector now fear that hundreds of thousands of jobs could be lost. Deutsche Welle's Adrian Kreis has the story.
We're in the center of Cape Town on Bree Street. Normally it's busy with cars, but at the moment businesses move their tables and chairs on the streets to protest against the current lockdown regulations and to highlight the plight of the industry. Many here are disappointed and angry.
Job saves lives! Job saves lives!
We haven't had an income for about 4 months now, and things are just getting worse. We just need some sort of support from the government, some sort of sign that can show us that, you know, we will be operating for some time. I mean, the industry is taking such a big hit, It's taking such a big hit. One of the best places are closing. Places we thought were making money are now really taking such a big hit. And it's just sad because there's just no support from anybody at this point.
We don't have much long left. I mean, we aren't the only ones. You walk up and down Bree Street, which used to be the gastronomic capital of Cape Town, and you see how many to let signs are up. We're in dire straits now. We're at breaking point.
At the beginning of the lockdown, restaurants had to stop their operation completely. Since June, they're allowed to operate again at limited capacity, and many here say this is not enough to survive. The sale of alcohol is banned, and many here rely on the bigger margins that they have when they sell drinks compared to foods. Also, there's a night curfew in place starting at 9 p.m., essentially killing the dinner business. The Restaurant Association of South Africa says already 70% of jobs have been lost, which means 800,000 people out of work. And further jobs could follow. The tourist season here starts in September, but there's no indication whether tourism will be allowed by then or not.
Deutsche Welle's Adrian Kreis reporting. The UN is deeply concerned about the escalating levels of hunger and poverty in Yemen, which has been in the grip of a bitter civil war since 2015. It forecasts that across large parts of the south, 40% of the population are facing acute food insecurity. A senior UN official has warned the country no longer has the resources to tackle famine. Here's the BBC's Lise Doucette.
Even before the coronavirus struck, Yemen was described as the world's worst humanitarian disaster. These new surveys chart its steady descent into an even deeper, more worrying crisis. The UN's new survey provides a detailed assessment of the devastating impact of multiple threats: war, floods, locusts, an economic crisis, and now COVID-19. In a separate report, the Norwegian Refugee Council says 94% of families in its study described food as a top concern. Nearly half said they'd lost at least half of their income since April. The UN senior official in Yemen, Lise Grande, warns that Yemen is again on the brink of a major crisis of hunger. But the UN's most recent appeal has raised only half of the life-saving aid Yemen needs.
The BBC's Lise Doucette. Kim Kardashian says her husband Kanye West has been diagnosed with bipolar disorder and said it's incredibly complicated and painful for many to understand. The rapper is one of America's biggest music stars and is attempting to run for US president. His mental health has come under increased scrutiny in recent days after he unleashed a series of bizarre statements and tweets. Kim Kardashian says her husband is a brilliant but complicated person and has asked for compassion and empathy as her family grapples with his disorder. She says Kanye is subject to criticism because he's a public figure and his actions at times can cause strong opinions and emotions. And that's World Watch for today. Back to you, Marnie.
Thanks, Annabelle. And that's Midday Report, Te Pūrongo o Te Pautūtanga for today, Thursday, July the 23rd. We'll be back tomorrow with interviews and the latest news from Aotearoa and the world. But for now, from the Midday team, kia tau te mauri, heia popo.
RNZ News at 1 o'clock. Good afternoon, I'm Paul Brennan. New Zealand First says it's refusing to back a $1 million jobs package for Southland because the case does not yet stack up. The region is preparing for the likely closure of the Tiwai Point aluminium smelter next August. Any money that goes to Southland won't come out of COVID-19 recovery funds, but will have to be found elsewhere, so Labour and the Greens are keen to progress the package. But they don't have the necessary backing of New Zealand First, which wants more analysis of the pros and cons. It also wants a government buyout of the smelter explored as an option. Air New Zealand has told MPs it was unprepared for the disruption wrought by COVID-19 and overwhelmed by the number of people seeking refunds. Appearing before a select committee at Parliament this morning, its Chief Executive Greg Foran apologised to customers who've had bad experiences. He says the airline system simply could not cope with the sheer scale of refund requests, with as many as 75,000 calls coming in one day. A wahine Māori has caught a racist landlord red-handed by reapplying with a European name after being rejected for tenancies. Te Iwi Kemp has applied for 10 Christchurch rentals in the past fortnight, but was told they were no longer available. When she reapplied as Maria, however, 3 of the landlords got back to her. She says she then confronted one of them.
I said, my name's not Maria, by the way, it's Iwi, and he just texted my other phone to say that the property was gone. And he just cracked up laughing, and he said, oh, yeah, good one. And he said, well, to be honest, I just don't want your type in my house. And I was like, what's my type? And he said, well, you're a Maori, aren't you?
Te Iwi Kemp. The South Island Whanau Ora Commissioning Agency is calling on its agencies to pay their staff a living wage. Te Pūtahitanga o Te Waipaunamu has provided funding to each of the 38 agencies it works with so they can pay 100 kaiarahi a living wage.
More than that. Hello. I'll start by providing an update on a couple of pieces of work that we're progressing to continue to bolster our fight against COVID-19. Then I'll hand over to the Director General for an update on today's numbers, and then of course we'll take your questions as normal. So first, a few words about improving access to important information. The Ministry of Health and the government, in fact, have received feedback from health providers that are all around the country that the cost of mobile data is proving to be a barrier for people to access key health and wellbeing information and services, particularly in the context of COVID-19. And so we want to remove that as a potential barrier. So the Ministry of Health has been partnering and has been working in partnership with the mobile network operators, Spark, Vodafone and 2 Degrees, so that Kiwis won't incur mobile data changes when they're accessing essential COVID-19 information, health information and resources, and online health resources. So in the first instance, anyone using these mobile networks can now access 11 key health websites and 2 GP portals free of data charges. That includes the COVID-19 website, the Ministry of Health website, a number of other websites, including support around mental health and wellbeing and Plunket. All of the mobile data charges for accessing these websites will be charged back to the Ministry until June of next year, with a 6-monthly review to confirm extensions to that initiative. That will ensure that the cost of accessing mobile data does not prove to be a barrier to people accessing those services. You'll also recall that the government set up the Contact Tracing Assurance Committee in early May to provide assurance that the recommendations from Dr. Verrill's report on contact tracing were being implemented appropriately. I've met with representatives from the Assurance Committee to discuss their early findings, and I'm expecting within the next day or two to receive their final report and recommendations, and I intend to outline a bit more of that to you next time we meet next week. It is critical that we take every opportunity we can to test the robustness of our contact tracing systems and to make sure that they are ready in the event that we need to use them and that the public can have trust and confidence in them. So now hand over to the Director General for today's update.
Thank you, Minister. Kia ora koutou katoa. So today, once again, we have no new cases of COVID-19 to report in our managed isolation facilities. So it's now 83 days since the last case of COVID-19 that was acquired locally from an unknown source was reported. And just to emphasise that all of the cases over the last few weeks have been identified during our assessment and routine testing of people in our managed isolation facilities. So that's showing the real value of having that very strict, thorough regime in those facilities. 5 of the current cases, or previously current cases, are regarded as recovered now, so the total number of active cases is 22. No one who is an active case is currently receiving hospital level care. Our total then remains at 1,205 confirmed cases. Yesterday, our laboratories processed 2,419 tests, and that brings our total number of tests to date to 448,786. And of those tests yesterday, just under 2,000 were in the community. So it's very pleasing to see that the work we have done over the last few days with the colleges, with getting the messages out, and obviously, and I want to thank New Zealanders for acting on that message, that if you are offered a swab, to accept the offer. We're continuing to work closely with the sector on ways to increase our testing rates so that we've got an adequate baseline level of testing in the community. That's our early warning system. And in fact, 2 evenings ago, I had a teleconference with my counterpart, the Permanent Secretary at the Department of Health in Australia, who is now Dr. Brendan Murphy, who was their Chief Medical Officer. He shared their experience from Victoria as well as New South Wales, and this reiterated the importance of the very tight regime we have in our managed isolation facilities, the very rigorous infection prevention and control, and as the Minister's mentioned, the real importance of having that rapid contact tracing capability and capacity. Last night we sent out to the wider sector updated information about who they should test, just reiterating those key messages. That will be, if it's not already, available on our website. And today we've got another meeting with the DHB chief executives to emphasise the role that they have in ensuring that there is good access to testing in their communities 7 days a week, that tests are funded for the practices and CBACs that are providing them. And our Chief Clinical Advisor Primary Care, that's Dr. Juliet Rumble-Smith, is meeting with our primary health organisation clinical leaders today to check in to make sure that not only do they have what those key messages are, but also they have everything they need to support their practices. And our PHOs, just a reminder, represent virtually all our general practices in the country, so that's all going to support us increasing those testing rates around the country. The chair of actually president of the College of General Practitioners, Dr. Samantha Merton, sent out a survey to GPs 2 evenings ago. Already by yesterday afternoon, 500 responses, and this survey again was asking them about what their capacity was around testing, ensuring that they had sufficient PPE, swabs and so on, and also asking about what the rates of declines of tests have been and what else might be needed to support people taking up the test. Finally, the New Zealand COVID Tracer app now has 618,000 registered users and over 80,000 posters created to date and over 1.5 million poster scans. Just again a reminder about the value of downloading the app, registering and scanning regularly to keep a record of where you have been. Thank you, Minister.
I'm happy to take your questions.
What are those rates of decline for testing, and why? What's the most common reason people are declining tests?
Well, you will have seen the numbers on a daily basis. You know, we did drop down from a peak of around 12 to 13,000 and went down to below 1,000 on some days. That's clearly too low. I've always been very clear we don't need to be up around the 12 to 13,000 where we don't have a need to be testing at that rate. So if there was, you know, a community outbreak, then we may want to see ourselves go back up to that high rate of testing. We've no need to be there at the moment, but the key thing is that we want to see testing sitting more around the 4,000 a day level. On average, there will be, you know, fluctuations that vary from day to day. Everyone's got a view on why the rates have gone down or up, depending on which day you're looking at. I think what's important is that the Director General and his team at Health are working very closely with all of those who have to do the testing to make sure that we're getting those rates back to not too high, because we don't need them to be too high, but back to a level that will give us all confidence that if there is any COVID-19 that we're addressing, that we're identifying it.
How many people are declining tests though?
So that's one of the questions they're asking in the survey. anecdotally, we've had feedback, including, of course, talking to the GPs like Dr. Samantha Merton. She gave us a bit of a readout, but one of the questions they've included in the survey is to give an indication. And once they've got all those surveys back by later this week, they'll do a little bit of analysis and provide us with the information, and we'll be happy to share that with you, including not just what the proportion is, but what the understanding why people are declining. I think that what we are trying to do, and have been over the last few days, is to remind people how important it is, even though we have no community transmission. And it's been great to see actually people have heard that message. And just to reiterate it again, if you are offered a swab, there is a good reason for that, and please do take the test.
Would you look at setting up some of the pop-up testing sites at certain markets again, just backstop?
I mean, look, that's ultimately a judgment for the relevant public health units, but I would note that probably a big difference when those CBACs were more widely used, it was because many other health services where testing would take place weren't operating, and so there was a need to have an alternative in place. Now people can go to their GP practices and they can be tested there, and so that of course that reduces the need for those independent testing places. But if the relevant public health officials determine that there's a need in an area, then of course they're still able to do that.
Get a test at the moment, do you still have to be 48 hours without symptoms following the test in terms of going back to work and things?
It depends on the circumstances under which you had the test. There is a bit of a differentiation there, and I'll get the DG to run through those for you.
Yeah, so one of the key changes in the case definition a few weeks ago was just to separate out that group where there was would be a higher likelihood or a higher risk, so the high index of suspicion group. And people who fall in that group, because they, for example, work at the border, or they know someone, or they live with someone who works at the border, those people will be asked to self-isolate until the test result is back. Others will not need to, and so that's one of the good reasons why we distinguish between the two groups. Most people who are tested, remembering that this is testing of symptomatic people with respiratory symptoms, most people will not need to isolate while they're awaiting the results of the test.
It's been well communicated though, because lots of people only have 5 days of sick leave. If they think that in order to go and get a test, I'm going to have to use up some of that sick leave, it's a pretty obvious barrier to going to get one.
I think it's something we can and should keep reiterating, and making sure people are aware that if they have a test because they are asked and they don't fall in that high index of suspicion group, they will not be required to self-isolate. So there should be no barrier, including a cost barrier, because they won't have to pay for it.
Are you disappointed with the uptake of the app?
Not so much disappointed. I'm interested in making sure we get up to the rates the Minister talked about, and that's why we've been working hard with the colleges, and why we've been putting the messages out to New Zealanders to get the tests done.
Look, I think we all need to reflect reasonably honestly on the circumstances under which the app was launched. You know, New Zealanders were feeling a sense of relief at the time, like we'd been through the worst of it, and they could take a bit of a breath and feel relieved, and so that's understandable. But our message to them now is we've all got to be diligent if we want to stay in the very good space that we're in. And so, look, there are a whole variety of reasons why people didn't take it up with the enthusiasm that we might have liked when it was first launched. The app is being improved as we go along. Additional improvements will be rolled out with the next update. But even just the step of updating your contact details by downloading the app and registering for it, actually you're playing your part, even just by doing that one small step.
Testing has gone on at the border for those high-risk workers?
Look, I haven't got the latest numbers. The numbers that I saw just after the weekend were about 400 tests had been undertaken so far. I don't know whether
that was Tuesday. By Tuesday it was over 400, and we can get some updated numbers, and we'll put those in the media release that goes out.
Where are things at with working out the regime for regular testing of people who work in the managed isolation facilities?
So that's the testing number, which we'll give later on. We've got a head from the District Health Boards now, a program of which facilities and when that testing will be done over the next week or two, and actually we're going to have a sort of a rolling program, and it will show where the testing is going to be done over the next 4 weeks.
Has there been a change in policy around flight crew isolation?
No.
Could you explain the improvements that are going to be made to the app and when they'll come about?
Sure. Some of the key improvements are allowing people to manually enter contacts or appointments where there's no QR code. So at the moment the app, in order to log something you have to have a QR code to scan. So it doesn't allow people to record, for example, if they go and visit friends or relatives where they won't have a QR code on their door. But those are still important contacts. If you go around to someone's house for dinner, we want you to be able to record that. So that will be allowed for. The second big improvement is it will allow people to add in things retrospectively. So if you get home after you've been out to a restaurant and you think, oh, I didn't scan or I didn't see a QR code to scan, you can add that in manually so that it's all recorded. What we want people to do is keep as complete a digital diary as possible, so that in the event that they become a close contact of somebody who has been identified, or they themselves are identified as having COVID-19, that we can rapidly contact trace. It is not the only tool, but the better that information, the faster the contact tracing process can take place.
Have those in place?
Though the advice I've had from the developers is that those updates will be in place by the end of the month, so the app will update by the end of the month.
As the Minister responsible for ministerial services, what work has been done or is going to be done about the potential use of taxpayer dollars over from Ian Lees-Galloway over that affair, and what will that work look like?
Look, I think as the Prime Minister has indicated, she's asked ministerial services to just have a good look and make sure that there is nothing untoward there. I don't want to preempt that. It's important that ministerial services do that work and that they do that independently, so they're not going to be getting any direction from me on that one. That's something that they can report directly to the Prime Minister on.
Timeframes?
Look, I imagine that it won't take a huge amount of time, but again, I don't want to put a deadline on it for them. It'll take as long as it takes, but I suspect they will do that as quickly as they can. Yes. All right. Covered that one. Any other questions for today?
State Services Minister, the value of having those health websites available without data charges, would you look at that in a public service sense across other sectors potentially?
Yeah, I think this is going to be a really good, if you like, pilot initiative where we can look at those resources that should be freely available to members of the public. I mean, this is what we've developed here is effectively the 0800 number equivalent for accessing these kind of resources. And if that proves to be effective in the health space, then it may well be that there are other, public services where we may look to adopt a similar approach.
MSD, for example?
Well, I can think of examples in education where it would be useful to do it. I can think of examples in, in the welfare space, the employment space, careers advice, those sorts of things, particularly, again, in light of COVID, where we might want to look at extending it. So I think this will give us a chance over the next few months to see how this is working, to make sure it's effective. And if it is, then we could certainly be looking at that.
How much will those data charges cost the Ministry of Health over the next year?
I haven't seen a cost estimate. I'm not sure whether.
No, I haven't seen it. We'll get that and we'll make it available. Yeah. But as the Minister outlined, this is a joint arrangement with the telcos. So I imagine there will be a good reduction in what the normal cost would be.
Yeah. All right. Thanks. And no questions about the rugby then? No. So.
Yeah. Have you done?
Wasn't going to let you get off that lightly.
Have you done much training, Dr. Bloomfield?
Not enough. Not enough, I dare say. It's 35 years since I last played a game of rugby, so I'm not sure how long I'll last on the field, and I'm glad there's a very significant rolling subs arrangement. Yep. Well, yes, the team at the Ministry canvassed a few options for me. I've actually got a few of them here. Hospital pass didn't make the grade. There was don't smash ash, but I'm been reassured by Minister Henare, no one in the parliamentary team is going to tackle me anyway, so I'm happy with that. But what I've settled on is the eliminator. Well, I'm listed at open side flanker, but I'm intending to run on the wing.
Thanks, everybody.